You're watching Fox 5 News at 5.
Tell you about the workout for some women that promises to give you a flatter stomach than you've ever had. We'll talk about it with Dr. Manny right after this break. And let's take a look at Fox 5 Health News for you tonight. There's a new type of exercise to help pregnant women before and after birth.
Fox's Julie Banderas shows us how it can give you an even flatter tummy than you had before the baby.
Nice.
Take a look.
From royalty to celebs, we've become obsessed with baby bumps. But ask any new mom and they'll tell you, once the baby is born, the bump has got to go.
And exhale, stretch, create space for baby.
Pre- and postnatal fitness expert Leah Keller says after childbirth, most women are often left with a mommy pooch, flabby abdominal muscles that are soft and weak.
Diastasis recti is a medical condition where your abdominal muscles, the rectus abdominis, physically separates. It's not a tear, but a sideways stretch of the connective tissue that runs down your midline. So when the muscles separate, they do not go back on their own after pregnancy.
But with a new approach, women can have a flatter tummy than they did pre-baby.
The DIA method is a complete system for pre- and postnatal fitness, and it's all built around correct core activation. So the entire system is built to protect your abdominal muscles during pregnancy, strengthen them for labor, and then get your abs back after.
OBGYNs say exercising 30 minutes on most days during pregnancy can help reduce backaches, constipation, bloating, and swelling, increase energy and mood, improve posture, promote muscle tone, strength, and endurance, and even help you get a better night's sleep. Leah says exercise is also crucial for preparing for labor.
The core muscles are key to birthing that baby. So you need the abdominal muscles to push safely and effectively, so they need to be strong, and you need the pelvic floor to be relaxed and open. That's the door for the baby to pass through.
There is evidence that the active phase of labor may be up to a third shorter in moms who exercise regularly. And it also seems as if moms who exercise may not go as far overdue. A shorter, more effective labor is always better.
If you've had your baby already, even years ago, Leah says it's never too late to get your body back and learn this technique. For more information, go to thediamethod.com. I'm Julie Banderas, Fox News.
Woo, Dr. Manny's back, and Dr. Manny, this is very exciting.
This is why I don't have a belly.
Stomach
Yeah,
than
right. In Mars, I don't have a belly.
Than before you had kids, because we know that it wasn't Katerina. It was, of course, you that carried the three.
Absolutely, I kept the whole thing. But go ahead, ask me a question.
Better than before you had kids. What do you think? Come on, tell
I
us
think
the
this is
truth,
great. Listen, we tell for a long time we're telling pregnant patients exercise is very important. Of course, check with your OBGYN because there are conditions that perhaps exercise is contraindicating, like premature labor and things like that. But it's very good for you because just like the package said, you can really regain a lot of abdominal muscles, which you're going to need for delivery. It's going to help you tremendously for back pain, which is one of the leading complaints that a lot of pregnant women have. And then you already are in sort of in a groove. So after you have the baby, you know, because remember, for a lot of women, they gain anywhere between 25, 30 pounds, sometimes even 40 pounds.
Yeah, could be.
So it's very difficult to let it go afterwards, so that if you're already in the mindset of exercising, then after you have the baby, shortly after that, you can go back
Manny,
and the routine.
This is obviously your field here, and as far as exercise...
What, exercise is my field? Go ahead, thank you.
As far as women exercising, right up to the due date, what do you recommend?
Yeah, well, you know, I think for a lot of women, they could do it. Some of them, they stop a couple of weeks before the due date. So if they can handle it, if they have a special place that they can go to, if they have a special individual that knows the limitations of, you know, the abdominal girth and things like that, then you can exercise all the way up to the end.
Okay.
So some women, you know how they talked about that thing that separates, well, I forgot what it's called, but the muscle.
Separation of the abdominal muscles.
This is claiming to be able to help that as well.
Well, that's what happens because for a lot of women, when they have their baby, they have that pouch that they can get rid of. And then it's all about, you know, the laser and all of these.
So what really works? Come on, break it down.
You got to build a muscle. You got to make sure that you have that abdominal muscle build up right from to the very end. And then after you have the baby, then a combination of dieting and abdominal exercises will bring that muscle back. And you're going to be in that
Stand up.
bikini in no time.
Because look at Manny, and he
Look
looks
at
great
me.
in his Manny
I got my
bikini.
abdominal muscles all put together.
All right, good exercise
Yeah,
and
right.
happy babies for everybody.
Happy
That's what we all
birthday.
want to
No
hear about.
bikini weather this weekend.
Yeah.